Hello, everyone. My name is Marty Guthmiller, CEO of Orange City Area Health System, bringing you yet another COVID-19 community briefing. We felt that the Thursday edition of the briefing is merited by a number of things going on and felt a bit of an obligation to communicate those things to you. So first of all, to stay with our history, I'm going to provide you with some statistics, which maybe provide a bit of a background for some of the comments that I'm going to make in a little bit. First of all, and in general, we're seeing an uptick again in the number of cases. Iowa 14-day average is 8.2%. That's up over the last 3 weeks, 7.8, 7.6, 7.1. So 4 weeks in a row of growth, if you call it growth, at 8.2%. 7-day Iowa, 8.3%. Last week's 8.0. The week before that, 7.6, and the week before that, 7.6. Closer to home at the 14-day average for Sioux County, 6%, 6.0. That's up from 4.7, which is up from 4.2, which is down from 6.9. So over the last 3 weeks, we've gone from 4.2 to 4.7 to 6.0 on the 14-day. On the 7-day, which is a little bit more of a shorter window and maybe a little quicker test of how things are going, 7.0% in Sioux County. That is down from last week at 7.8, but up from the week before that at 2.9. So about, a little more than double what we were 2 weeks ago in terms of the infectious rate. Within the last 7 days, the age classifications for those people testing positive is kind of all over the map. And 0 to 17 years old is 11%. 18 to 39 are both 18%, both being 18 to 29 and 30 to 39. So this with those two, well, I guess it would be 36% then combined between those two. So a lot, over a third of our infections are between 18 and 39. Another 22% are between the ages of 40 and 59. So there's 58% are below the age of 60, and plus the 0 to 17 at 11%. So the most alarming stat, though, is that 60 to 69, 25% of our positives are in the 60 to 69 age category. So we'll talk more about what that means as we go forward. Also started to look around a little bit into the region. What are we seeing out there in the region? And just FYI, I'm comparing 7 days to 7 days. Again, Sioux County 7 days, 7.0%. Lyon County 15%, a little more than double. Dickinson 15%. Clay County 14%. Plymouth 9%. O'Brien 6%. And Woodbury 8%. Again, I looked at the number of counties in the state. There are over 30 counties that I counted at 10% or more. So it's about a third of the state is at 10 or more % positivity rate again. In addition, and to tuck away in your data bank, there are 8 facilities currently in the state of Iowa in outbreak status. And by facilities, I primarily mean long-term care facilities. I'm not aware of any of those in our area, but as an example, 2 weeks ago, that number was 3. So we've gone from 3 outbreak facilities to 8 in a period of 2 weeks. Stepping back then to Region 3, some negative trends there in Region 3, the 20 counties in Northwest Iowa. 52 are hospitalized in Region 3 as of today. That number a week ago was 31, so it's up 21, almost double. The week before that was 35, and the week before that 33. So clearly a number of increase in cases of inpatient COVID population. Of those 52, 15 are in the ICU. That is up more than double from 7 a week ago and from 12 2 weeks before that. Of the 15 in the ICU, 3 are in the ICU. Are on ventilators. And the week before that, of the 7, 2 were on vents. So 52 hospitalized, 15 in the ICU. Those numbers are definitely up. Deaths, I'm also monitoring. 6,268 deaths. I think it's important to recognize. In a little bit, I'll talk about keeping things in perspective. There have been 0 deaths in the state of Iowa from the beginning of the outbreak of COVID. 0 deaths below the age of 30. So 0 to 29, that number remains at 0%. 30 to 39, 1% of the deaths have been in that age category. Of the 6,268 deaths, 92% are in conjunction with pre-existing conditions. So there will always be outliers to these situations, but this thing has been pretty consistent from the beginning that it is not causing death in young people. Certainly under the age of 30, there have been none. And it's with people with pre-existing conditions. And that's why we talk so much about keeping that engine tuned and dealing with the pre-existing conditions that you're aware of and that you can, including body mass index, blood sugars, blood pressures, those kinds of things, is to pay as much attention to that as we can. So again, all of this information is intended to provide a bit of a backdrop for some of the other things we're going to talk about now in terms of what's really going on at the ground level here at Orange City Area Health System. Clearly, this is tough for everybody. There's no question about it. This collective COVID burden that I referred to is growing. Let's all do our best to recognize that and keep this thing in perspective. It's very real. We need to take it seriously, but keep in mind the statistics that I've given you previously regarding the pre-existing conditions, the age groups that it's affecting most negatively. Keep those things in perspective and treat each other kindly. We are seeing, again, what I refer to as the COVID burden manifesting itself in things like people starting to strike out against each other. I'll give you some specific examples. We had one of our volunteers at the hospital verbally abused the other day for asking somebody that walked in to wear a mask. And the person turned around and walked out. They have every right to do that. That's fine, but they do not have the right to abuse our volunteer staff, and we will not allow that to continue. I don't blame the person responsible for that as much as I blame the COVID burden over time. We also received a comment and some questioning why we continue to push the vaccine as opposed to promoting the treatments available. Well, clearly the vaccine prevents the virus from happening to a large degree. We have all the treatments that are available here, and we've talked about those in the past. The monoclonal antibodies, which have proven to, in the Stanford statistics that they cite, the monoclonals have reduced hospitalizations by 50%. Clearly, we have those treatments. Again, it's a way to keep things in perspective. If you do get ill, you are hospitalized, there are treatments that we have that have proven now to be very effective. That doesn't mean you willy-nilly go out and get infected, but to keep things in mind as we move forward into this. We are still highly recommending everyone to be vaccinated. Everyone who is eligible at this time to be vaccinated. And when I talk about that, I'm talking about the age group and the age restrictions and limitations. If you have questions on that, call the clinic and we'll be glad to help you out with that. The benefits of being vaccinated clearly outweigh the risks. The risk of infection is greatly reduced. It's not eliminated, but it's greatly reduced, as is the depth of the illness or the acuity of the illness when you do get it. Breakthrough cases are going to happen. That's just the way things work. But we've shown here in our hospital, and again with the monoclonal antibody and things like that, the people that are vaccinated clearly do not get as sick, and clearly are avoiding hospitalizations, and clearly recover much quicker. There's no question about that from the data that we have, firsthand observation, and all the research that we have available to us. There are several questions regarding the boosters. First of all, the boosters are not an approved thing yet. That's anticipated later in September, and it will be something post 8 months from your second dose. Those are not clear-cut rules or directives yet by any means. Who is eligible for a booster shot today are those with immunocompromised things going on. What's the definition of immunocompromised? In reality, it is if your physician says you're immunocompromised, you're immunocompromised. There are listings of those things, but the bottom line is that if during a visit you're having a conversation with your physician and he or she indicates that they'd like to have you get a booster, but because you're immunocompromised, that fits the criteria and that can happen. Other than that, everybody has to sit on the sidelines for a while and wait. When there is more of an announcement to make on that, we will be sure to do yet another community briefing or do some other kind of communication, identifying how you go about getting the booster, and we'll be sure to let you know that. We think the next 30 days is very critical. With college back in session, with schools back in session, this virus has been one that it's always a look back kind of thing. So we'll look back and say, well, 2 weeks ago, here's where we are. It's always that look back kind of thing. So we do think that in 30 days, we're going to be able to look back and see whether or not how we made it through, of course, but is there more to come? And there might be, but we do think that if we can get through that next 30 days, we're going to know a lot more about what we can expect for the rest of the fall. Just another thing, if you can stand it, on vaccinations. If you are unvaccinated, that's your choice, and you have the right to make that choice. You will in all likelihood, get the virus. In all likelihood, that will be fine. And you can deal with that. However, getting the vaccine greatly reduces your chance of getting ill. And if you do get ill, it greatly reduces the ill effects. No question about it. That's where it is. And so that's our position. We remain there. We encourage you to get vaccinated if you haven't. We encourage you, of course, to keep things in perspective, to be kind to one another, to understand each other's position, and understand that someone's actions might be stemming from some of this collective COVID burden, and give them a break, give them the benefit of the doubt. Again, treat everybody kindly, and keep that engine tuned. So I think that's it for today. I wanted to give you that information. We appreciate the trust and confidence that you place in us. And I wish I could say there won't be any more COVID briefings in the future, but and I hope there are not. But if there's a reason to give you all an update, I'll certainly be back and do that. Thanks again for joining us today.